My favorite thing about being a midwife is saving a mother's life. I am Fatmata Kadabo, a midwife educator. I work at the School of Midwifery in Sierra Leone, commonly known as SOMBO. I'm a midwife tutor, educator, and I double as the deputy head of school. We live in resource challenge settings. So when you deliver a woman and you save her life, especially if she is bleeding, which is the leading cause of maternal mortality globally and in Sierra Leone, you feel happy. I do feel happy when I save a mother from dying, which we call near miss, and when you give that baby back to that mother, you receive the baby and you give the baby to the mother and to the family. They are so happy to take that baby home. Having a skilled birth attendant present at birth is one of the recommendations made by World Health Organization, and it helps to save the lives of our mothers, especially in the rural communities where these midwives are placed upon completion of their training, because they are trained according to the core competencies of International Confederation of Midwives. They are able to provide quality and respectful care for our women. They are able to provide care, and they are able to identify when there are deviations and make prompt referral. I decided to become a midwife because when I was going to school, I lived among nurses, right? And I had an aunt who used to conduct home delivery. She was a nursing assistant. And whenever the women come, she will check them. By then, I didn't know what it was. She will check them, and then she will tell them, those women in the neighborhood, and tell them, go and come at this time. And when they come, it's like she played a miracle. And then they give birth. What is it that she's doing? So that was how initially I was motivated. I also had an aunt who was trained in the UK. She came back home. She was working in Kenema in charge of the antenatal clinic. So when we visit her, she will be there singing with the pregnant women, passing messages to them in the form of singing. That also caught my attention. And these are the things that really motivated me. When SEED came, they brought in the educators. That relieved us from the burden of work. We were overwhelmed with work. So they are here. They are assisting us in school. They are also assisting us in the clinical settings. And they have been able to bring in their experts, because Alice, coming from Malawi, has worked on the direct entry program, and Adelaide has been a cohort in Nigeria. So they brought in that expertise of theirs, and we are learning from them. The other thing that's made us to value their presence in the school is that they were able to identify the gaps in our in the curriculum that we developed for the direct entry program. This is a new program, but because they have been part of it from the different countries that they came from, they were able to easily identify all those gaps, and they have helped us to work on those gaps that they were identified, and now we have worked on it, and we are implementing the work that we have done. And the other thing is that for the first time, we have developed, with their help, we have been able to develop the scope of practice for nurses and midwives in Sierra Leone. That's one will soon come out, and everybody in Sierra Leone will benefit from that document. We really appreciate the good work that SEED is doing. They have planted a seed. That's what we take. They have planted a seed. That seed has germinated. And because the seed has germinated into a big tree, it will soon become a forest in Sierra Leone.